Are you looking for a new field of work? Have you heard about the sleep field and want to know more about it? Do you want to know how you can break into the field of sleep medicine? In this short program, Sleep Health Management Resources will answer all of these questions and more. So what is polysomnography? Polysomnography is the study of sleep. A polysomnogram is a diagnostic test during which a number of physiologic variables are measured and recorded while the patient is asleep. Pictured, you see a patient who is hooked up for her overnight sleep study, and you may notice that she is in a room that is conducive to sleep. This picture was taken in a very basic sleep center. There's a twin bed, and it doesn't look very homey or comfortable looking. Most sleep centers today, even hospital-based sleep centers, try to get the testing rooms to look more like a bedroom at home. This makes the patients feel more comfortable and less anxious so that they are able to fall asleep just like they would at home. You'll notice that this patient has some tape on her face. The white markings that you see are actually electrodes or sensors that we have taped onto her face. This is done when applying some of those sensors to reinforce them so that they will stay in place while the patient is sleeping. We have electrodes attached to her scalp, to her face, near her eyes, on her chin. We have sensors on her neck to monitor snoring. We have the blue straps around her chest and abdomen to monitor breathing effort. And we also have electrodes, which you cannot see in this picture, placed on the patient's legs to monitor whether she kicks her legs during the night, which may be contributing to her restless sleep and awakening her throughout the night. All of the electrodes and sensors that are attached to the patient are hooked into what we call a head box, which is the blue box that you see resting on her bed. Those electrodes kind of look like a bunch of spaghetti the way that they're laying there right now. Part of what you will learn in class is how to neatly apply and connect those wires into that head box to make it easier for you to disconnect the patient, and it's a time-saving measure in disconnecting the patient in the morning. So how about jobs? Are there jobs available? Sleep medicine is one of the fastest growing allied health professions. Growth of accredited sleep centers over the years is rapidly increasing. We show 1,500 accredited sleep centers across the country. This is changing on a month-to-month basis, increasing dramatically. There are also many non-accredited sleep centers out there as well. So 1,500 may not seem like a lot of sleep centers, but now check out your area. There's probably several non-accredited sleep centers also available. And the non-accredited sleep centers may be very good sleep centers, so you shouldn't be afraid to seek employment at a non-accredited sleep center as well. So some of the sleep centers that we're seeing are actually growing, expanding the number of beds, but we are also seeing new sleep centers pop up as well. Types of training to prepare yourself to work in a sleep lab include medical field crossover. This is where you may already be working as an RN, as a paramedic, as a respiratory therapist, as an EEG tech, or another allied health field, and transfer into the sleep center. What we're looking at with the ASTEP program is called a short track program. Short track programs such as ASTEP move very quickly. There's a lot of information presented in a short period of time, so these programs are not for the faint of heart or slower learners. These are for individuals who have a tendency to be able to pick up on concepts relatively quickly. There are also 1 to 2 year programs available. These are typically held through community colleges. There are accredited and non-accredited 1 and 2 year programs. If you choose the route of a 1 or 2 year longer program, then my recommendation is going to be for you to make sure that that program is accredited. There are 2 credentials that can be obtained after working in the sleep center. The Board of Registered Polysomnographic Technologists, or the BRPT, has 2 credentials available for sleep techs. There are several pathways that lead to eligibility for the RPSGT exam. One of those pathways is completing this 80-hour ASTEP program plus the 14 self-learning modules that are available through the Academy of Sleep Medicine that follow the 80-hour introductory component. And then there's also an on-the-job training component that is required as well. Once you complete the 80 hours, the introductory learning component, you would be required to work 9 months on the job. A new credential that's available is a CPSGT examiner or Certified Polysomnographic Technologist. This also includes the ASTEP program plus 9 self-learning modules and some on-the-job training time as well. Once again, it is a fast-growing field. There are jobs available. You really need to do your due diligence and check your local area to see what the availability is specifically in your area. I like to tell people that if you expect to drive or to find a job within 15 minutes of your residence, then it's probably not the job for you. If you are willing to drive an hour to an hour and a half one way to your job, there is a job there for you. You have a pretty good likelihood of being able to get a job. ASTEP is an acronym which stands for Accredited Sleep Technician Education Program. The ASTEP program is accredited by the American Academy of Sleep Medicine. Sleep Health Management Resources works with accredited sleep centers to bring this program to you at a variety of locations. Sleep Health Management Resources' role in the ASTEP program is to supply the didactic educational component as well as some follow-up components with students and employers once the program has been completed. We provide a qualified registered instructor to teach in the classroom setting for the 2-week 80-hour program. The accredited sleep center that we are aligned with will then provide a mentor to the students during clinical portions of the program.